Man-made accidents, such as unintended chemical and radiologic releases in source water, can also be a major disaster and have very long-term consequences, as Judith will discuss with you. Intentional contamination or water terrorism, and again, using water contamination and lack of access to water as a weapon of war or an effective tool during a social conflict. And for those of you that are history buffs in the crowd, you have to remember that the Romans were very effective at using water contamination to defeat their enemies. They would purposefully place human cadavers or animal carcasses in their enemies' well water. Very, very effective from a psychological point of view as well as an infectious disease point of view. So for hundreds of years, water has been used as a weapon of war. Now, again, every nation, every community is vulnerable to these water disasters, no matter where you live. But what is also true, no matter where you live or what economy you come from, careful medical preparedness for these water disasters can really make the difference between a controlled response to a water contamination disaster versus a public health crisis or nightmare in your community. For those of you that are from the United States, I have an example of this slide. We are the perfect example of an economy that has many, many resources and a natural disaster called Hurricane Katrina that created a public health nightmare instead of a well-prepared public health response to this natural disaster. This slide is from the Disaster Medical Assistance Team operation in New Orleans. And again, you see dehydrated newborns, chronically ill hospitalized patients in the airport after Hurricane Katrina. Again, we were a nation that was not prepared, and we ended up having a very serious public health crisis and nightmare by not having our medical preparedness strategies in place. So again, we can't prevent a major event from occurring. I wish we had the control of the skies for flood or earthquake control, but we can make a major difference by preparing our communities through thoughtful preparation and planning. So what are you talking about, Dr. Meinhardt? I'm going to give you 15 key water disaster response strategies that I want you to embrace and think about. Clearly, there are many others, and there's lots of depth to each of these strategies, but I'm just going to briefly go through them to get us starting our dialogue. Now, I believe that these strategies can be applicable at a global, regional, country, and local level. Most of us now understand that, whether it's the United States or Haiti, the first 36 to 96 hours you may be on your own. Before you can get federal or international support coming in, many of these strategies need to be in place at the local level as the first step. So I believe they have application across the board. So I'm going to again present these to you, and I believe that they apply to all of our strategies. This is again an example of Hurricane Katrina. You can see the bottled water at the bottom, and the whole idea of the concept. We're going to be talking about what's necessary as far as pre-planning for trying to replace water once it's gone in your community. So here's strategy number one. The first really key medical strategy is extremely important to incorporate in all water disaster planning. We have to understand that water contamination planning and the disaster response strategies are really necessary for three main reasons. The public health and the medical consequences of water contamination can be overwhelming and dramatic. We have doubled upon that the secondary disruption to potable water and wastewater treatment, which is critical and necessary for sanitation and basic hygiene, adds to the disease burden. And thirdly, there is the psychological impact of the public's lack of confidence in water and water safety, and frequently lack of access to water during and after a water disaster event, which leads to chaos and disruption, again, unnecessary for an affected community that's already being affected by these other consequences of a water disaster. Strategy two. We have to ensure that alternative sources of drinking water are in place to guarantee that an affected community has adequate potable water. That's easier said than done, but we do need to think about it before the disaster occurs. And we're talking about alternative sources of water, not just for days or weeks or months, but in some communities for years. Very long extended period of time. This is an example of a Canadian waterborne disease outbreak. This is a distribution center. You can see on a little picnic table. This is a very small rural community. They needed to have bottled water brought in for 10 months in this community. Now, this will pale in comparison to a disaster like Haiti. So we need to be thinking about tens of thousands of gallons of bottled or tanked in water for a long period of time. It's impossible to do that after the fact. Well, you really need to be thinking about what your resources are and how you would get it out into the field before the disaster occurs. So preparing for this scenario is really critical, obviously, for the basics of public health and for preventing death from dehydration. Strategy 3. Most folks focus on the drinking water, alternative sources for drinking water, but that is not how any of us live, as we talked about yesterday. You have to include advanced planning for provision of other critical water needs, such as food preparation, sanitation, and again, commerce. You need to get the economies back up and running after a water disaster. So it's not just drinking water. We need everything from set aside for cooking and bathing, particularly hand washing, and we need to set aside water for business and agriculture in an affected community. Remember that most people, particularly who are concerned about their livestock, are going to want to have some level of water for maintaining their livestock as well. Now, it's controversial about what that minimum should be for all of us. It's anywhere from 2 to 5 gallons or 7 to 18 liters, depending upon the requirements for water in the diet and the cultural needs. But you can see that that escalates dramatically as you're thinking about that number per person per day for weeks, months, years. So planning for alternative water is key to preventing a public health crisis. This is a photo, again, of distribution logistics from Hurricane Katrina. And I bring this point up again. Army and National Guard were brought in to deal with distribution. We all know that setting aside alternative water is the first step, but getting it distributed can be even a bigger challenge. Law enforcement is necessary, not only to provide labor for water distribution, you need to have security. When people are desperate, when they're dehydrated, when they're trying to protect their children, it's a chaotic situation. So I'm a big believer in thinking about distribution and security at the same time. Strategy 4. The most important thing I'm going to say today is the following, so everybody listen. This is the most important message. All water disaster planning has to prioritize the special needs of susceptible populations that are most at risk for illness and death from dehydration, most at risk for waterborne disease and the health effects of water contamination. Remember that any water-related disease can present as a benign disease in a general healthy population, but that same exact water-contaminated exposure in a vulnerable population can lead to significant illness and death. So all medical planning for water disasters must include the needs of special sensitive populations. This is a photograph, again, from this Canadian outbreak that I described to you. This is a 5-year-old resident who was cute, put in the beginning of the line with her 2 bottles of water for the day. Again, absolutely critical that we prioritize our planning. Who are these special populations? All of you already know them, but let me just quickly run through them. Remember from yesterday, we talked about waterborne disease and disease burden in a society. These are the folks who take a disproportionate share of the disease burden from water-related disease. Neonates, infants, any resident or patient who has a pre-existing chronic condition, whether they have liver disease, diabetes, or any sort of immunologic disorder. Geriatric, the elderly, nursing home patients. Anyone who's immunocompromised or suppressed with HIV/AIDS. Anyone who's undergoing any kind of immunosuppressive therapy, such as organ transplantation or potentially on corticosteroids for asthma, etc. Anyone who's being treated with chemotherapeutic drugs. All pregnant women and developing fetuses. And I have to also say, all malnourished residents who are at increased risk of developing waterborne diseases have to be added to this list as well. Another strategy, 5, it's really important when you're thinking about medical preparedness for water disasters to think about the fact that there are multiple ways for human exposure to contaminated water during an event and to try and develop some strategies that allow you to intervene. Obviously, all of us know ingestion and absorption of water can give us waterborne disease, but dermal absorption of contaminated water, either through bathing with contaminated water or through the rescue effort of many residents, can also be an exposure pathway. People can pick up waterborne disease, obviously, from food that's contaminated directly with water, or if they don't have water for hand-eye hygiene, contamination of food